Hi, I'm Dr. Emily Arsenault, Medical Director of Arsenault Dermatology. As we start seeing patients in the office again, it's essential that we develop new procedures to keep our patients and our team as safe as possible. In preparation for your upcoming appointment, I'm here to present these new procedures to you so you'll know exactly what will happen the day of your appointment. So let's get to it. Our new COVID-19 in-office procedures meet or exceed federal and state recommendations for social distancing and environmental protections. We've taken multiple steps to both minimize as much interpersonal contact as possible, as well as to frequently sanitize surfaces, especially in spaces such as examination rooms. To begin, all patients will arrive to our office location at the time of their appointment. To support social distancing, we're asking all patients to remain in their vehicle upon arrival. Announce your arrival by texting a response to your appointment reminder. This number is specific to the practice location of your appointment. The text will be received by our front office team member who is sitting physically within the location. You'll receive a confirmation text acknowledging that we know you're here. For those patients who are unable to stay in their vehicle or who do not have the ability to text message, please walk up to the front door. You will be greeted by a team member who can assist you. Crowd control is a big part of our new procedures. There is no need to walk up to the door if you've texted the team. Once it's time for your appointment, you'll receive a text saying we're ready for you. This is how we're able to control the flow of patients into the office. You'll walk up to the front door where we have a new COVID-19 screening station. A team member will provide a warm greeting. You'll then be given a pump of hand gel and asked to sanitize your hands. If you do not already have a face mask, one will be provided to you at this time. Finally, the team member will use a touchless infrared thermometer to check your temperature. If you do not have a fever, you'll be permitted to enter the building. Rest assured that every other person in the building, both staff and other patients, have undergone this same procedure. Everyone in the building will be wearing a face mask and will not have a fever. Our team is required to undergo multiple temperature checks throughout the day in what is quickly becoming a healthcare industry best practice. Just a few notes before we continue. In order to keep the total number of people in the office to a minimum, we will only allow patients to enter the building. Exceptions will be made for parents or caregivers. And please be courteous about our supply of masks. While we will provide masks to anyone who needs to enter the building, we have a limited supply, and we need to reserve as many masks as possible for our patients receiving treatment and for our team. Now that you've been cleared to enter, you'll be greeted by a front office team member. Just walk up to the area indicated on the floor. Our already streamlined registration process is reduced even further to its most basic elements. You'll be asked to confirm your demographics, provide insurance and ID cards, and to sign in. Every object you touch will be sanitized from the previous patient, just like it will be sanitized once you leave this station. Hand gel dispensers are available to you at multiple points in the service chain, including registration, your examination room, and upon exit. After registration, you'll be immediately directed to your examination room. We've propped open doors within the office to minimize contact on high-touch surfaces like door handles, and sanitize all high-touch surfaces at least once per hour. Your examination room is sanitized between each patient visit with a medical-grade disinfectant. We sanitize all surfaces in the room, including the examination table, side chairs, countertops, and high-touch surfaces such as cabinets and drawer handles. We also sanitize our iPads and any other equipment used between each patient visit. Again, hand gel is offered in the examination room, or if you prefer, you may wash your hands in the sink. Our goal with examination is to maximize your time so the benefits of the exam outweigh any potential risks. Based on the problem you need treated, we will arrange the room and staff in the best way possible to minimize contact. I want to emphasize this next statement as much as I can. If at any point in the experience you feel uncomfortable for any reason whatsoever, you may leave at any time. We understand this may be the first time some patients have been out of their homes for many weeks or even months. And while we're doing everything we can to protect you, some patients may recognize that they're not ready to receive treatment once they're physically in the space. If so, that's no problem at all. No need to feel embarrassed. We're here to serve you. Just let any team member know and we'll direct you to the shortest pathway out of the office. We'll contact you by phone and reschedule your appointment for a different time. Since this is a new situation for us all, our providers will need to coordinate with you during your exam. For example, if the area of concern is under your face mask, you may be asked to briefly hold your breath so your provider can take a closer look while minimizing contact. If the area under your masks requires treatment longer than a single breath hold, such as performing a biopsy, your provider will present the treatment plan, including the risks and benefits, to you first. You decide if the proposed treatment plan is within your comfort level. Please understand that as we follow CDC guidelines, there may be procedures or areas that we're not able to safely treat at this time. We will do everything possible to reschedule this procedure to a time where contact protections are reduced. Once your appointment is complete, our team will coordinate with you the best way to leave the office. Our goal is to minimize your contact with other patients as much as possible. All patients will skip the usual checkout process, and our team will contact you by phone after the appointment to schedule future visits and to collect any balances. Because these COVID-19 procedures are so new to the practice, and since the situation will change over time, please be aware that we may make slight modifications. But rest assured, our team is focused, well-trained, and consistently monitored. Everyone on the team must adhere to these procedures at all times. And the same is true for our patients. Patients who refuse to wear a mask or refuse to be temperature checked will not be allowed in the office at this time. If you're unable or unwilling to adhere to these new procedures, have any flu-like symptoms, or have had any recent close contact with anyone with flu-like symptoms, please call us at 941-907-0222, and we are happy to reschedule your appointment for a later date. The COVID-19 pandemic is changing our in-office procedures, but it does not change our steadfast commitment and dedication to your health care. Thank you in advance for helping us keep you and the other patients and our team as safe as possible while the entire country navigates reopening for business. And as you can see, we're engaging the highest standards possible for you. We look forward to your upcoming visit, and we thank you for choosing Arsenault Dermatology for your health care.